Hi, as a medical doctor using botulinum toxin or anti-wrinkle medication in Ireland for almost 20 years, how do I decide what brand I'm going to use for my patients? Number one for me is always going to be safety. Has that product been approved by the HPRA, the Health Products Regulatory Authority? And they're responsible for licensing about 10,000 products and medicines for use in Ireland. I want to see the clinical studies so that I can use my independent judgment, looking at those studies, looking at the data, seeing how long it's been in production. I'll ask my colleagues what they're doing. I have many trusted colleagues around the globe, and I will put all of those factors together and then make a decision. It also generally depends on what product you train in, and you build up experience with a number of brands. For example, there are many brands licensed for use in Ireland, and they include Illusions, Azalure, Bocature, Botox, Nucivia, Letabo, Dysport and Vistabel. And these are all types of botulinum toxin A, and they have subtle differences. Sometimes they might act a few hours faster than another, sometimes they'll spread a little bit further from the injection points, and sometimes they may last a little bit longer. But there are a lot of similarities between them. The medicines need to be safe. I need to source them from reputable suppliers, and I need to store them impeccably. I need to be scrupulous with my dosages. I need to use them in the right patients who are suitable and not use them if somebody's not suitable. And I want to respect that medicine so that I protect its use for the lifespan of that patient who may want to have that treatment over a number of years. It's really down to the independent clinical judgment of the doctor or dentist who you're seeing to pick the product. I do some consultancy work for Allergan, who make Botox and Vistabel, but I also use other brands, and we need to be using that independent clinical judgment for picking what's best for our patients, staying as safe as possible. If you're having treatment, always ask to see the product, ask to see the expiry date, ask why they're using that, what sort of experience they have. And there will be new products coming on stream over the coming years, and the HPRA does great work in regulating those products. But there are products that are just completely unlicensed for use in Ireland, and their use is illegal. It's really important we stay as safe as possible. And do get in touch if you have any questions. Take care. Bye.